Hello, 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 and welcome back to the channel. It's your public health advocate here in your community safe space where meaningful conversations take place. Now today we're wrapping up our autism section where this is our fourth and final one. And today we're not just continuing with the empowerment and the advocacy, but we're looking at the urban and rural divide, how things change based on where you are and what you can do to advocate stronger and more effectively and efficiently. So it's still a cold day and we're going to continue. We are not going to pause. This is the final one. I got your questions, I've got your comments, and now we're wrapping it all up. Busy day. Okay, so let's start. Let's get on our journey. Let's walk, let's talk. Let's answer the questions that you have. Advocacy, taking care of those we care for and caring for our community. This is our autism goal. Talk to you. Let's go. Isn't it a beautiful day? So let's get the discussion started. Now, what I want to encourage and emphasize is that this last portion here, we're talking about autism on a tight budget. We're talking about access, advocacy, and the urban and rural divide. Now, let's start. I like the scenarios, I like the examples, and today's no different. A mother sits in her car outside a therapy clinic. She's been on a waiting list for 14 months. Insurance denied coverage. The nearest autism specialist is 90 miles away. Her child needs help. She needs answers. And today, we're talking about the truth no one wants to say out loud. Autism support in America depends on where you live, how much you earn, and how well you can fight the system. This is the final chapter of our autism series, and we're bringing it all together. So, on a tight budget with autism, services are expensive. Diagnostic testing can cost thousands. ABA therapy can cost tens of thousands a year. Yes, tens of thousands a year, the cost of ABA therapy. Speech and occupational therapy adds up quickly. Even transportation becomes a barrier. Low-income families are faced with many challenges. These include long Medicaid wait lists, limited provider options, fewer therapy hours that have been approved, and high out-of-pocket costs. But here's what many families don't know. Early intervention, and when I say early intervention, I'm speaking about from birth to 3 years old, is federally supported. Public school services are free under the IDEA. Medicaid waivers can cover therapies. I remember we discussed that in the previous video. Nonprofits and university clinics sometimes offer sliding scale services. We also discussed that, so you could go back to the video, summarize it, or go through the transcript and get the points you need there. The system is complex, but not impossible to navigate. It's a maze. Access isn't just about money. It's about knowing where to apply, understanding insurance codes, navigating referrals, and following up repeatedly. And that is a portion of it that causes the most distress. It's the following up repeatedly portion. Many families wait 12 to 24 months for diagnosis, 6 to 12 months for therapy to start. Just to get that start date, 6 to 12 months. Delays matter. Early support changes developmental trajectories. Families without time, transportation, or flexible work schedules tend to fall behind. Access to care is a public health issue, not a parenting issue. So now we're going to we're owning in on that urban versus rural autism care. In major cities, they have more specialists, more therapy centers, more private options. while in rural areas, we find fewer developmental pediatricians, limited therapy providers, long travel distances, and telehealth becomes often the only option. Some rural areas have 0 autism specialists. Yes, 0. Families drive for hours. They miss work, pull children out of schools, or simply go without services, and that's to the detriment of the child. The divide isn't just an inconvenience, it's developmental inequity. So that inequity that starts only gets worse. When a child is born, let me stop for a moment, and we say most parents are anxious during pregnancy, and we understand that. But where a child is born should not determine whether they receive early support or not. When it comes to autism and special education advocacy, once a child enters the school system, everything changes. Parents must learn what an IEP truly guarantees, how evaluations work, how to request services in writing, and what appropriate education legally means. Under the Individuals with Disabilities Education Act, IDEA, children are entitled to a free and appropriate public health education, which most people refer to as FAPE, F-A-P-E. But here's the truth. Schools operate with limited budget, and we are all aware of that. We've heard the conversations. Parents who don't know their rights accept minimal services, and that's why advocating is important. We are trying to educate and inform, but we want to make sure that the resources that are available in the community are used appropriately, and no child is faced with minimum services. Advocacy determines outcome. Again, advocacy determines outcome. You can request evaluations in writing, ask for independent evaluations, bring advocate to the meetings, or disagree with the IEP decisions. Advocacy is not aggression. And remember, we covered a few of these in a little bit more detail in part 3. So advocacy does not mean aggression. It means protection of your loved one. Autism is not rare. Autism does not discriminate by income, but access to support does. If you're a parent navigating this system, you are not failing. You are navigating a system that was not built equally. And if you're a policymaker, educator, provider, or public health leader watching this, the question isn't whether families are trying hard enough. No. The question is whether we are building systems that serve the family purposefully and meaningfully, effectively, and of course, efficiently. Early intervention is not charity. It is prevention. It is equity. It is public health. If this series helped you, if you found that you understand access better and it's serving you productively, I want you to share and I want you to subscribe. The information is not useful if you don't use it, if you don't share it. We cover public health issues affecting families across rural, suburban, and urban communities, across every socioeconomic level. So comment below. What has been your biggest barrier? Is it cost? Is it location? Or is it the school system? Let's have this conversation. Let's talk about it. Because what I want you to understand is that for there to be equality and equity, we have to serve the community. We have to advocate for the community. And we have to understand that there are advocates out there within the school system, within the healthcare system, but nobody has all the tools and all the information. So as we learn, we share, we gather. So until the next time, we walk and we talk. This is the wrap up for a 4-part series on autism. I hope it was helpful. Let me know in the comment section. Share it with a friend, and we'll continue our public health advocacy. See you soon. Enjoy your beautiful day.